Today, I'm going to present a 5-minute case. Now let's go ahead and start.
Let's read the case. Mr. Stevens is receiving sulfasalazole, Gantracin, for a recurrent bladder infection. He tells you he feels like he has the flu. He describes his symptoms as feeling warm and achy with a headache. And what we are going to do today is discuss how we would determine if Mr. Stevens might have a problem more serious than the flu. Now, the case facts are Mr. Stevens is receiving sulfasalazole. He has a recurrent bladder infection. He feels like he has the flu and he describes his symptoms as feeling warm and achy with a headache. Now, bladder infection is a type of urinary tract infection. This refers to an infection anywhere in the urinary tract, such as the bladder, kidneys, ureters, or urethra. Can be acute, meaning they occur suddenly, or chronic, meaning they recur over the long term, in which what Mr. Stevens have. Most bladder infections are caused by E. coli. This type of bacteria is naturally present in the large intestines. Then an infection can occur when bacteria from the stool get onto the skin and enter the urethra. Now, what are the symptoms of bladder infection? So some of the most common symptoms include pain or burning when urinating, cloudy or bloody urine, urinating more often than usual, foul-smelling urine, frequent sensation of having to urinate, and cramping or pressure in the lower abdomen or lower back. Now, sulfasalazole is a sulfonamide antibiotic that helps keep bacteria from going in your body. It is used to treat or prevent many different types of infections caused by bacteria, such as ear infections, meningitis, and yes, bladder infections. Drinking sulfasalazole has its common side effects. Those are stomach pain, bloating, gas, headache, dizziness, ringing in your ears, tiredness, nausea, or vomiting. Sulfasalazole also has its adverse reactions, and on this list, one here shows the symptoms that Mr. Stevens is complaining. And in this case, it might be that Mr. Stevens is experiencing some of the adverse reactions of the drug sulfasalazole. Now, most bladder infections subside within 48 hours of taking the appropriate antibiotic. It's important to finish all antibiotics prescribed even if you're feeling better. Some bladder infections can worsen and spread to the kidneys due to antibiotic-resistant strains of bacteria, delayed or inadequate treatment, or other health issues. If you have recurrent urinary tract infections, it's important to see your doctor. You may need certain tests to make sure your urinary system is otherwise healthy. Chronic bladder infections require a combination of treatment and more aggressive preventive measures. Being proactive about bladder infections can help reduce their occurrence as well as the pain and possible complications that accompany them. The earlier you seek treatment, the less likely it is that the infection will spread, and sooner you'll feel better.